Get informed. Get educated. It's all about your health. This is Healthy Living with Dr. Lateef Akinola.
Hello and welcome to the next episode of Healthy Living podcast series. Today we have a versatile, eminent professional in the person of Dr. Segun Ebitanmi. He is the former Financial Secretary of the Healthcare Federation of Nigeria. One of the caps is wearing, and he is also the CEO of CareOne digital healthcare system in Nigeria, and he has got in his belt 25 years experience as a medical doctor and administrator, eminent digital technologist. He's going to briefly introduce himself to us today, and we welcome him. I'm sure we're going to benefit a lot from his experience and what he's going to tell us today. Dr. Ebitanmi, you're welcome.
Thank you, sir. Dr. Akinola, it's an immense pleasure being here. I'm Dr. Segun Ebitanmi. I'm a medical doctor, a health system architect, and a business manager. I've run health systems in this country for over 20 years. I started with one of Nigeria's first medical software companies called Synapses. Eventually, I more or less co-founded Outreach Hospital Group and grew it from a valuation of 50 million to a valuation of 6 billion today over a period of 10 years. Lately, I've started CareOne Digital Hospitals. It's a hospital management as a service company with a vision to deliver a national health system driven by data and intelligence, delivering quality and sustainable healthcare to all Nigerians by 2030. I have 15 hospitals across 5 states, and we've grown revenue, we've saved lives, and we are contributing to the development of the health system.
Yeah, thank you so much for that. Now, what is your vision, for Nigeria, development of Nigeria healthcare system? How can we break the gap between the low income, middle income, and high income, segment of the population?
I believe very strongly that the private health system in Nigeria is what is going to deliver universal healthcare. I believe that the governments, from federal to state and local, who has not been able to get it right in the last 60 years, will never get it right, because we are a highly plural country, highly tribalistic, highly individualistic. The only thing all Nigerians agree on is what a naira is. So I believe that with the growth in the private sector, that the IFCCs contribute 70% of healthcare anyway, that private sector is one that is going to do the 100% and is going to provide universal healthcare to all Nigerians. Healthcare eventually is going to become higher quality, it's going to become cheaper as we have more economies of scale, more or less how we have the GSM revolution. When we started with just a few lines, and now we have over 200 million active lines in Nigeria, and a SIM card is virtually free. Healthcare is going to evolve like that. We're going to have health institutions that are going to have economies of scale, deliver very high quality at a low price.
Yeah, you mentioned, just now that it's the private sector that will be the primary driver, to deliver equitable, accessible, quality healthcare in Nigeria.
Yes.
Now you know that healthcare delivery is an expensive, system. If you want quality,
Yes.
you have to pay, the expense.
Yes.
How do you envisage, where do you put the government? Because not everybody may be able to afford, such an expensive healthcare system. So our insurance system is still in the budding stage, so to say.
So I think the primary role of government should be to aggregate funding and care for the multidimensionally poor, and to regulate. Those are the two areas that I think government has a role. They should totally get out of service delivery. They should aggregate resources. They should put money into NHIS and grow the base. There are 133 million multidimensionally poor people in Nigeria. The federal government of Nigeria should cover those 133 million people, should divert all the money that is used to pay the professors and the teaching hospitals and cover these 133 million people. Push this 133 million to the 10,000 doctors in the Association of General and Private Medical Practitioners and come back and assess the quality. Drive the quality using the payment mechanism. So if you don't meet the standards, NHIS now cuts you off. So let that demand be the stimulus for the private hospitals, who should be the only ones delivering care, to improve the quality. So I see government in two places, in summary: aggregating resources from all our channels, from oil, from donors, from everything, and pushing that into covering the 133 million Nigerians who live on less than $1 a day, and then to come and regulate and assure quality. Government is not doing enough of that because they are not putting enough attention, and they are trying to do the service delivery which they are not set up to do. So they are not losing both ways. They are not funding enough and they are not regulating enough. They should just choose a hustle. They are not delivering as good enough service, they are not funding enough, and they are not regulating enough. They should get out of the service delivery, face the funding, and face the regulation.
Yeah, but at this moment, that's basically what our government is doing. They are, they are doing, they have their own hospitals which they manage, although all of it not as good as we find in the private sector. Private sector drives at least 70% or more of the Nigerian healthcare system. So, but I'm worried about the coverage of those indigent people. I mean, in the budget, we have loads of money, pushed aside to help such indigent people, but they are not getting it.
Yeah.
So how do we make our government? We can't just say government go and set up policies and then regulate or something. They need to care for these people, which they have been trying, but maybe the population is a lot, but they are not, we are not getting it. So what could be better than if we have the private and the government coming together in an agreeable, policy-driven way, transparent way to drive the healthcare system? And we cannot also push the insurance aspect aside. That will also come, in tandem with such a policy. How do you see the government playing their role to deliver quality healthcare system, accessible quality healthcare system in Nigeria, especially for the low-level people of the population?
Okay, sir. So for the benefit of emphasis, the government has a very crucial role in covering the bottom of the pyramid in Nigeria. 133 million people living on less than $1 a day. Most of them cannot afford private hospitals on their own. So the government needs to there is a vulnerable group social health insurance scheme. The government needs to expand that to cover all 133 million people. NHIS now is 1,500. The federal government needs to put aside around 200 billion a month to cover these people and push them to private hospitals for coverage. And the government hospitals, the general hospitals, the teaching hospitals should be privatized. There should be a PPP framework that allows private entrepreneurs like yourself, who have proven that you can deliver a high-quality system that is sustainable, to run. So government has the facilities. Right now, I will not mention the name of the teaching hospital, a very first generation teaching hospital in Nigeria. As recently as 1 month ago, a cousin of mine died there because there's no oxygen. And this is a teaching hospital that gets billions in subventions monthly. So I'm super convinced that government civil servants will never be able to run efficient and effective health system simply because there's a big disconnect between who is responsible for paying them and who they are responsible to deliver service to. In the private sector, it's very easy. The patient comes in, pays the money, you deliver the care to the patient. If you don't deliver good enough care, the patient doesn't come back. In the public sector, you can give, no matter how shitty care you give, the federal government will pay the staff. So there's no incentive for anybody in the civil service to deliver quality care. So we need to redesign that framework and remove that disconnection of responsibility. Let's have PPP. That is how I see government and private sector working together. It means private sector coming to run government facilities with a mandate, a quality mandate and a sustainability mandate. And then the federal government using the 2.4 trillion it is going to save from that exercise, using that money to finance the multidimensionally poor. Thailand did it. Thailand chose to put all its revenue in demand side. The government of Thailand got out of running any teaching hospital or any private hospital or any primary care center. And in 10 years, they covered the whole country. So Nigeria can do that too.
Yes, of course we can do it. We have the intelligence, the people, and the infrastructure to support that. But we are not doing it. Basically, I believe that my worry is not for the upper segment of the society. They can fend themselves. They can have the treatment here. They have the opportunity to go abroad for their own care. I'm just worried about the lowly. Even then we have the insurance NHIS. It's not enough to cover them. And then everyday health delivery system, healthcare in all the world, in all parts of the world, is getting much more expensive. Yeah. And then because of the expense, the lowly don't have access to, to quality healthcare system. Now, hospitals, based on that, the footfall to hospitals are dropping. Hospitals are closing, because they cannot be a sustainable enterprise. They don't have, the clientele to support it. Where does CareOne come in?
So as CareOne, we
amalgamate all the closing hospitals, or what is your plan?
That is exactly what we are doing. So CareOne analyzed the market. And the market is like this. I will try to summarize it in what I will call the 5 truths. The first truth is that 800,000 children are dying in Nigeria every year, the highest in the world. The second truth is that Nigeria, according to the BBC, has been declared as the most dangerous place for a woman to have baby in the world. The third truth is that Dr. Raymond Kuti, the national president of the Guild of Medical Directors, declared last year that 50% of hospitals closed down. The fourth truth is that the IFC, in this report, The Business of Health in Africa, declared that 70% of care in Africa is delivered by the private sector. And the final truth is that the cost of care, the cost of operations, as evidenced by salaries, by power, by every input that a hospital needs to deliver care, has gone up, while the price that the hospital can charge has remained constant. So hospitals are becoming less and less profitable. So if you look at these 5 truths, the end point is that babies are dying, women are dying, hospitals are dying. and we don't have money to change it. So CareOne comes in, and the vision of CareOne is to aggregate these hospitals that are closing down, reduce their cost of service delivery, have one gynecologist cover 4 hospitals, have one pediatrician cover 5 hospitals, have one manager cover 3 hospitals, such that we can cut down the cost of care by over 50% in the hospitals within our network, and then leverage on a strong brand to pull in more patients to these hospitals, so that the capacity utilization of these hospitals will move from around 10-15% to what you see to maybe around 70-80%. And then the hospitals will now be profitable and then sustainable. So the vision of CareOne is to aggregate 1,000 of these kind of hospitals within the next 3 years, put them in a single network where quality is portable. We have one group quality manager that is assessing the quality across the group. Patient experience is portable. The same standard of patient experience you have in our Mount Pisgah Hospital in Ikotuengbe is what you have in our Rodin Hospital in VI. And then the profitability now starts to grow. And then these hospitals becomes profitable and the system becomes sustainable. So that is what CareOne brings to the system.
Now, where are your hospitals located? The hospitals under CareOne.
So we have
at the moment
15 hospitals, 16 hospitals. We just closed one yesterday across 5 states, basically in the southern states of Lagos, Ogun, Ondo, Enugu, and Rivers states. We are now setting up a 100-bed babies hospital that's going to be the largest in Africa, in Kano. The hospitals typically serve the urban for now, because we are building CareOne in 3 layers. There will be a layer of 100 hospitals in the urban centers, and then another layer of 1,000 hospitals across all the local government areas. And then finally, we believe that AI will eventually come to drive primary care and reduce the health burden in Nigeria, while ensuring that this is done at 90% of what it is done today.
So when you talk about, nice that you mentioned artificial intelligence and technology, you're, as an experienced technologist, how will that help, CareOne, to spread its tentacles around Nigeria?
So CareOne is running on 5 technology stacks. So at the core of it, we run on the Safe Care quality platform. It's a digital quality platform that has over 200 indicators, and it tells you where you are at any point in time. So all our hospitals are on the quality improvement journey, and they all have this journey mapped onto even their mobile phone. So a manager at any point in time can assess his hospital and say that at this point in time, I'm 10% or 20% or 30% gone. So we leverage on that platform for quality improvement. Then there's our electronic medical record platform, which is a single platform. So technically, as at now, CareOne is like one hospital with 16 branches. So if you go to any of our hospitals, medical record is portable, you can access your records, and I can sit in one place and see the quality of care that is being delivered. I can see the encounters, I can see a doctor that is complying with guidelines and the one that is not, and we can take it up. We also have an enterprise resource planning platform, which does the billing, the human resource management, the customer relationship management, which does the business operations in a hospital, and that is also seamless. Finally, we have some patient-facing technologies, which is like the CareOne app. On our CareOne app, you can book appointment at any of our 16 locations. We have a feature called Book for Me. So you can book for your friend or for your parents from anywhere in the world. And then we have a virtual care platform where we used to do telemedicine. So put together, these technologies allow me to sit here and have these 16 hospitals running, according to guideline, according to standards, and ensures the 3 promise we make to those hospitals, which is to deliver quality care, rich patient experience, and enhance profitability.
Thank you. Now, what about human resources? You can have all the gadgets, all the infrastructure in the world, you can have all the buildings, the machines. If you don't have human resources to drive it, there was going to be problem. So how do you envisage, you have tentacles all over Nigeria. How do you build up your human resources?
So right now, we are still sourcing from the market. Luckily, we are still 15 hospitals, so we've been able to manage that. And we've discovered that there is a shift in the expectation of the health workers now. So when we do adverts, we get a lot more responses from when an average hospital does it, because health workers now do their research and they look at the structure of the organization that is seeking them. So they kind of feel that the structure that CareOne is running, we provide a good career opportunity for them. So we get a lot of responses when we advertise. But we know that that is only for the short term, because it will get to a point that there's just not enough. And our plan is to contribute to developing the human resource for health. So we are already working on a property somewhere not too far from here to set up a school of nursing. It's going to start with maybe neonatal nursing, which to us is the single most critical need in Nigeria, because 241,000 babies die. We're going to start with neonatal nursing. It will now become a full-fledged nursing. And maybe sometimes in the future, we can even build a medical school to be supplying more doctors to the system.
You have, fantastic and great vision for CareOne. I wish you the best. However, how do you see yourself, your company, in the next 10 years? Where do you see yourself?
Okay. So I will just use the CareOne vision to answer this question. Our vision is in 5 parts. So CareOne's vision is to become a national health system. By national health system, we are building CareOne to be an operating system for healthcare in Nigeria, the same way you have a computer operating system, such that applications can run on it. Hospitals can be application, services can be application. So we see ourselves as becoming the national health system, driven by data and intelligence. We see AI doing a lot. We see a lot of other local intelligence also contributing to delivering this quality and sustainable care. So we become a national health system, driven by data and intelligence, delivering quality and sustainable health care. There has been so much talk about quality and affordable health care. Trillions of dollars have gone into quality and affordable, but not sustainable health care. And that is why we are here today. So our mantra is quality and sustainable health care, not quality and affordable. So we will become a national health system, driven by data and intelligence, delivering quality and sustainable health care for all Nigerians by 2030.
So who are your backers or partners that you look up to drive you to your goal in the next few years?
Our core partners are, at this point, are technology partners. So we have a company called Signalytics from America, from Canada, and they have an edge server that has so much redundancy. It's deployed anywhere in Nigeria. Even if there's no internet, it will continue to run. We're also partnering with EHA clinics for our EMR. So we are using their platform. It's built on Open EHR, very scalable and very amenable to plug and play with the AI infrastructure of the world. And then we are using the ERP of Odo. Those are the ones that we are developing. And for the demand side, we have very strong partnership with the NHIS. For example, the hospital in Kano is going to be mainly financed by the NHIS. NHI is going to financing babies now. So, and then the private HMOs, AXA Mansard, Leadway, Reliance, we have very close working relationship with them. So between our demand side partners, the HMOs and NHIs, and our supply chain partners, our technology partners, we hope this ecosystem can deliver the vision of CareOne.
So if someone come to you now, wants to be a member of CareOne, so how will you sell your system to that person?
So we have our value proposition is in 5 parts. We typically go for owners who, for whatever reasons, want a proper management system to run their hospital. Because most doctors are not trained to manage hospitals. They are trained to manage patients. A lot of doctors decide to use that skill to manage hospitals. The way I jokingly say it is that you cannot use anatomy to manage facility or use physiology to manage finance. So for doctors who have recognized that management technology is a separate specialization for medical technology, we have 5 things to say for them. First thing is, we are not going to allow your hospital to die. As I said, Dr. Kuti said half of hospitals died last year. Second thing is, we are going to ensure that you keep your name. So that name you've built over 30, 40 years will remain for at least another 50 years. Third thing is that we take over all the headache of running a hospital, looking for diesel, looking for owner, chasing HMOs, looking for doctors. All that headache will go. We'll take over everything. Fourth is that we are going to improve the quality of your hospital. I'm going to bring specializations. We have a nephrology practice that's running within us. We have a neonatology practice running within us. We have just concluded on a cardiology practice. So we will enrich the value proposition of your health system. We start running specialist clinics, doing specialist surgeries that has not been done there. And to crown it all, we will give you the kind of money that you have never made from that practice. So using these 5 things, I jokingly say any owner who is at the stage that he needs this, who doesn't need this, needs to have himself examined.
Okay, thank you so much. There you go. We had it from Dr. Ebitanmi, and he's trying to do an Herculean task. We all wish him, the best of luck. It's not an easy thing to run one hospital, let alone running multiple of hospitals across different zones of Nigeria. We wish you the best of luck, and hopefully in the next 10 years, you will, grow as much as you wish. Thank you so much for listening to us this today. And we will come your way again next time, bringing some other eminent personality to you. Please like our feeds and, share among your social media platforms. Thank you so much. Bye for now.